Hello, and welcome back to the Training Toolbox. In this clip, we will be looking at an introduction to the circulatory system, 2 common cardiac emergencies, and what to do until medical help arrives. This clip is an introduction to first aid, and therefore does not replace a first aid course. However, it will provide you with valuable information and tips that could help you if you are faced with an emergency situation. Okay, let's take a closer look at the circulatory system, shall we? The heart is a 4-chambered pump that moves blood around the body through the blood vessels in a smooth and continuous cycle. It is approximately the size of your fist, and it sits behind and to the left of the breastbone. The top 2 smaller chambers are known as the atria. The right atrium receives deoxygenated blood returning from general circulation. The left atrium receives oxygenated blood from the lungs. From the atria, blood flows into the 2 larger, lower chambers known as the ventricles. When the ventricles contract, deoxygenated blood from the right ventricle is pumped to the lungs, and simultaneously, oxygenated blood from the left ventricle is pumped into the aorta for distribution to the whole body, including the heart itself. Because it is a muscle, the heart requires its own supply of oxygenated blood in order to function. The blood supply to the heart is delivered between heart contractions through the coronary arteries, which surround the surface of the heart and feed the heart muscle. Narrowing or blockage of these coronary arteries can lead to angina or a heart attack. A heart rate that is too fast, more than 180 beats per minute, will reduce the amount of blood the heart receives, as there is insufficient time between contractions to adequately fill the coronary arteries. The heart also has its own electrical conduction system, which provides electrical stimulation that causes the muscle cells to contract, enabling blood to be pumped from the heart. In conjunction, the respiratory and circulatory systems combine to supply oxygen to all cells throughout the body. A problem with any component of these systems can lead to serious complications and even death. There are a number of conditions that will compromise the ability of the circulatory system to provide adequate oxygen and nutrients to the body's cells. The 2 most common conditions that have the potential to result in serious consequences are angina, heart attack. Let's explore these conditions in more detail now. The first condition we'll look at is angina. This is a heart condition caused by restricted blood flow through coronary arteries that are narrowed as a result of the buildup of plaque or fatty deposits along the arterial walls. The chest pain that is associated with angina occurs because inadequate levels of oxygenated blood are reaching the heart muscle. This is why an increase in heart rate brought about by exertion, exercise, or anxiety often leads to an attack of angina. As the heart rate increases, the heart muscle requires more oxygen to be able to function effectively. When the oxygen is not available due to the restricted blood flow, chest pain occurs. The pain is described in many ways, but most commonly it is referred to as crushing, a heaviness in the chest, tightening around the chest, or simply a discomfort. It is rarely described as a sharp pain. Generally, casualties who suffer from angina are aware of their condition and have medication to assist with alleviating the symptoms. Angina medication comes in either a measured dose spray or a dissolving tablet, and both are administered under the tongue, where it is absorbed through membranes into the bloodstream for rapid distribution. It is also important to understand that angina can lead to a heart attack, and that the signs and symptoms are the same. All instances of angina should therefore be suspected and treated as a heart attack. You've probably heard the term heart attack before, but what does it really mean? Heart attack, also known as an acute myocardial infarction, is caused by a complete blockage of a coronary artery. A heart attack is usually sudden in onset and may occur at rest or under exertion or stress. A heart attack presents in the same way as angina, but the symptoms will not be relieved by rest or medication. A lack of oxygen causes damage to the heart muscle, which disrupts the heart's electrical system. This disruption can cause an irregular heartbeat and poor circulation. You will need to act quickly, as a heart attack is a life-threatening emergency and every minute is vital. The sooner a casualty can be treated by professional medical personnel, the less likely it is that there will be permanent damage to the heart muscle. Signs and symptoms that indicate angina or a heart attack can include a central, crushing type of chest pain that lasts more than 10 minutes, pain radiating up the neck, pain radiating down one or both arms, shortness of breath, increased breathing rate, increased pulse rate, irregular pulse, pale, cold and sweaty skin, nausea and or vomiting, and sudden collapse. Not all heart attacks involve chest pain. Some casualties just look and feel unwell, although they may have some of the other listed signs and symptoms. When treating a casualty for angina or a heart attack, follow these steps. Have the casualty stop all physical activity, remain calm and provide reassurance. Encourage the casualty to rest. If the casualty is conscious, place them in a position of comfort, usually sitting up to assist with their breathing. Provide assistance to the casualty in taking any prescribed medication they have to treat chest pain or angina. Call 000 for an ambulance immediately. Keep the casualty calm. Regularly monitor and record the casualty's vital signs. If the casualty is or becomes unconscious, call 000 for an ambulance immediately. Okay, let's recap. When treating a casualty for angina or heart attack, follow these steps. Have the casualty stop all physical activity, remain calm and provide reassurance. Encourage the casualty to rest. If the casualty is conscious, place them in a position of comfort, usually sitting up to assist with their breathing. Provide assistance to the casualty in taking any prescribed medication they have to treat episodes of chest pain or discomfort from angina. Call 000 for an ambulance immediately. Keep the casualty calm. Regularly monitor and record the casualty's vital signs. And if the casualty is or becomes unconscious, call 000 for an ambulance immediately. You have now come to the end of the toolbox clip on cardiac emergencies. This clip is just one in a series of first aid related topics which I would encourage you to take a look at. And remember, this is an introduction to first aid and does not replace training in first aid.